Hi folks, guys, so today's topic is about what? Acute heart failure. Okay, so how to answer exam question. Okay, my beloved students, take your pens, papers, and let's go. What is acute heart failure? Not chronic. Chronic was previous lecture. So if you find in examination tickets, in exam tickets question like this, so we have to understand that acute heart failure refers to a sudden onset of exacerbation of heart failure as symptoms that require urgent, immediate medical attention and absolute attention. So it can manifest as severe dyspnea at rest. So we remember that heart failure principal sign is a dyspnea, shortness of breath. So it can manifest as a severe dyspnea at rest, orthopnea, difficulty breathing while lying flat, orthopnea. Paroxysmal dyspnea, especially during night, so-called nocturnal, sudden shortness of breath at night, fatigue, palpitations, chest pain, and signs of fluid overload such as pulmonary crackles, peripheral edema, and elevated jugular venous pressure, and hepatojugular reflux. My beloveds, you have to understand one principal thing. As long as I exist as your teacher, as long as I exist as your professor, as long as I exist as your master, if you want, as long as I exist a chief of internal medicine, as long as you exist as a student, I will ask you about this. What? Killip classification. My beloveds, if you don't know Killip classification, you know nothing about acute heart failure. And don't find acute heart failure and Killip classification separately from myocardial infarction. It's a acute myocardial infarction classification. Yes, I know, unfortunately, in some new books, in some new articles, unfortunately, in some dictionaries, now I see this separating. Killip classification is a classification of acute myocardial infarction because in absolutely vast majority of cases, 99% of cases, acute heart failure goes with acute myocardial infarction. So if you try me to answer acute heart failure without Killip classification, you will fail. I swear it to you. So let's talk about Killip classification. You know Killip classification, you do not fail. So 4 classes. The Killip classification, this classification is used to assess of the severity of this acute heart failure based on a clinical findings and presentation. It helps risk-stratify patients and guide management decisions. So we've got 4 classes. Killip class 1. Patients in this class have no clinical signs of acute heart failure. They may have mild symptoms such as fatigue or dyspnea with exertion, but there is no signs of fluid overload on physical examination. So actually we can say there is no dyspnea signs. So if acute myocardial infarction goes without severe dyspnea, we can say that this is acute myocardial infarction. So you fix a diagnosis, place, STEMI, non-STEMI, anterior and posterior myocardial infarction. Point Killip 1. So Killip 1, no signs of dyspnea, no signs of heart failure. Killip class 2. Patients in this class exhibit the presence of rales or crackles in the lungs, indicating pulmonary congestion. Despite this, they do not have evidence of frank pulmonary edema. So we can say that Killip class 1, no dyspnea. Killip class 2, there are little signs of dyspnea, actually not subjective, but objective signs, means that we have so-called interstitial edema. Not pulmonary edema, of course. So, of course, surveillance differs. Killip class 1, no problem with survive. Killip class 2, there is a problem. of high mortality. Mortality starts to rise. Killip class 3. Patients in this class present with evidence of the frank pulmonary edema, such as pink frothy sputum or severe respiratory distress, and they may have significant pulmonary congestion that require immediate attention to relieve the symptoms. So, in Killip class 4, it's a cardiogenic shock characterized by severe hypertension, systolic blood pressure goes down less than 90 millimeter mercury, and signs of peripheral hypoperfusion. They have severe pulmonary edema and may present with altered mental status, all extremities. Very high mortality. So like Killip 3 and Killip, actually class 4, it's a cardiogenic shock. Mortality is around 100% if you do nothing. So Killip classification system helps clinically quickly assess the severity of acute heart failure and determine appropriate management strategies. Treatment may include oxygen therapy, actually discussing this oxygen therapy, diuretics, of course, to reduce fluid overload, but in case of cardiogenic shock, they don't work actually properly. Vasodilators to improve cardiac output. No, some vasodilators, of course, but very specific. Inotropes to enhance myocardial contractility, mechanical ventilation for respiratory support, and immediate revascularization procedures, if it's possible, of course, in the case of acute coronary syndrome. So all cases are acute coronary syndrome. So the goal is to stabilize the patient's conditions, relieve symptoms, and improve outcomes. But just remember, Killip class 4, no signs of heart failure. Killip class 2, interstitial edema, so no evident presence, no obvious presence of dyspnea, but in auscultation we can hear presence of crackles in the lungs, indicating beginning, it's crepitation actually, it's not crackles, in the base of pulmons of the lungs. And finally Killip class 3 and Killip class 4 with very high mortality. Class 3 is a pulmonary edema with sputum, pink frothy sputum, and finally Killip class 4, cardiogenic shock. So, quite enough for your response. No Killip classification, no answer for acute heart failure, as well as a member of a jury. It's not a joke, my beloveds. I'm absolutely serious. God bless you. See you in another lectures.